Come in.
Hi, are you Kelsey?
I am.
My name's Gabrielle Smiertelny. I'm a PA student. It's my laptop, literally.
Oh my gosh, I didn't even notice. It blended in with the door.
Okay, let's.
I can just work it out.
Well, I looked over here and I couldn't see myself because my laptop was like just.
I was like, oh, that's kind of weird. Like, it's not even in the shot. Okay.
Yeah. Okay.
Come in.
Hi, is this Kelsey?
I am.
Is this Kelsey? I am.
Is this Kelsey? I am.
Pure gold.
Okay. Take 3. Come in.
Hi, are you Kelsey?
I am.
My name is Gabrielle Smiertelny. I'm a PA student. I'm going to be asking you some questions today. Can you verify your name and date of birth for me?
My name is Kelsey Wright, and my date of birth is 4/18/2004.
Awesome, thank you. What brings you in today, Kelsey?
I think I'm having an acute asthma exacerbation today.
When did it start?
So this morning, I started coughing a couple hours ago, and so my mom took me to the clinic, and then they admitted me to the hospital from there.
Okay, what kind of symptoms were you having a few hours ago?
I was having some difficulty breathing, some pain, and then my mom said I was turning blue.
Oh, okay. Has it been this consistent cough since the onset?
Yeah, I thought I was just getting a cold, but then I started coughing, and I just couldn't stop.
Okay. Do you have any associated symptoms with this, like pain in your chest?
No, not really. I mean, yeah, I've had a little bit of chest pain, but my asthma's just gotten really bad over the last month. And I've been taking my inhaler about 3 to 4 times per week now. But other than that, I haven't really had any other associated symptoms.
Okay. So how would you rank this in severity in comparison to your other exacerbations or just your asthma in general?
I think this is probably the worst exacerbation that I've ever had.
Okay. Has anything helped to alleviate this current episode?
I tried to alleviate it with 2 puffs of my rescue inhaler, but it didn't help.
Okay. Do you feel like anything has aggravated or caused this current episode to occur?
No, it just kind of happened and it just keeps going and getting worse.
Okay. Do you feel like your asthma in general is worse at night or in the morning or any timing that affects it?
No, it's been pretty consistent.
Okay. Have you had any fevers or chills with this current episode? Because you said you thought maybe you were getting a cold.
Yeah, no, I haven't had any fevers or chills with it.
Okay. Can I ask you some past medical history?
Absolutely.
Did you have any conditions as a child, or were you diagnosed with your asthma as a child?
I was diagnosed with this asthma at age 5.
Okay. Did you have any other conditions currently that you're being treated for?
Nope, asthma's the only thing I have.
Okay. Have you had any surgeries or hospitalizations?
Nope, I haven't been hospitalized or had any surgeries.
Okay. You said that you have a rescue inhaler. Are you on any other medications?
My rescue inhaler, it's an albuterol inhaler that's 90 micrograms, and I take it 2 puffs every 4 hours. And then I was also prescribed Q-Var 240 micrograms, 2 puffs every two times per day.
Okay. Do you have any allergies to any medications?
Not that I know of.
Okay. Do you have any other like seasonal allergies to pets, pollen?
Nothing like that.
Have you had any travel outside of Indiana or outside the United States?
I've just been in Indiana.
Okay. Have you been up to date on your vaccinations, MMR, chickenpox? MMR would be measles, mumps, and rubella, the HPV vaccine.
I think I'm pretty much caught up. I haven't had the HPV vaccine or a flu shot.
Okay, so no flu shot this year? All right. Do you mind if I ask some questions just about your life in general?
Yeah.
Okay. So, who do you live with currently?
I currently live with my mom and dad and my 2 younger sisters.
Okay. Are you involved in any sports, or how's school for you?
I'm not on any sports teams. I just kind of babysit on the weekends for some extra money.
Okay. Do you use any tobacco or any illicit substances?
Mm-mm.
Do you consume any alcohol?
Mm-mm. No.
Do you consume any caffeine?
Sometimes I'll have like a Coke or a Dr. Pepper every once in a while, but not really.
Okay. Can I ask you a few questions about some other symptoms?
Mm-hmm.
Okay. Have you had any headaches or ear pain?
Mm-mm.
Or sinus congestion, nasal drainage?
No, I don't think so.
Any palpitations in your chest?
Mm-mm.
Any changes in your appetite or your weight?
Mm-mm. Not that I've noticed.
Have you had trouble sleeping or sweating at night?
Mm-mm. No.
Okay. Have you had any changes with your going to the bathroom, like peeing or pooping, anything like that?
Mm-mm.
Okay. Well, I'm going to talk to the doctor, and I will get back with you.
All right, sounds good. Thank
Thank
you.
you. Kelsey Wright is a 15-year-old female patient that presents today with an acute asthma exacerbation. Started about 2 to 3 hours ago with just a cough, and she thought maybe she was getting a cold. However, the cough has persisted, and her mom has brought her into the emergency room. The cough has not changed in the past 2 to 3 hours and has become more severe. She tried her albuterol inhaler in order to alleviate it, however, it did not work. She doesn't feel like anything aggravated this particular time, although she does feel that her asthma has been worse in the past 2 to 3 months and has been needing her rescue inhaler 2 to 4 times a week, which is much more than her previous 3 to 4 times a month. She describes her coughing and this current exacerbation as causing a tight feeling in her chest and just she can't catch her breath. She doesn't report any changes during the day with her asthma. It's not worse at night or in the morning. She does not have any other associated symptoms along with this current exacerbation besides the shortness of breath and tightness in her chest. She does not have a family history of any COPD or asthma or any other lung conditions. She was diagnosed with asthma when she was 5 years old, and she has been on an albuterol inhaler and a beclomethasone inhaler since then. She does not have any allergies. She does not have any other current medical conditions that she takes any medications for, and she does not have any childhood conditions. She has not had any surgeries or any hospitalizations. Her albuterol inhaler is 2 puffs every 4 hours, and her beclomethasone inhaler is 2 puffs 2 times a day, morning and night. She has not traveled outside of Indiana, and she does not have any other allergies including medications or seasonal allergies. She lives with her mom and dad and 2 younger sisters. She is a high school student who likes to hang out with her friends. She babysits on the weekend for a little bit of extra money. She does not use any alcohol, tobacco, or any illicit substances. She is up to date on her vaccinations, but she did not get the flu vaccine this year. She denies any headache or fever, chills, any disturbances in her sleep, or any changes in her weight. She also denies night sweats, as well as any changes in the frequency of urination or defecation, and changes of appetite.